What is test anxiety? Presented by the University of North Georgia's Student Counseling Center. It's normal to be nervous about school. We have aspirations and want to do well. However, there's a difference between anxiety and stress. Anxiety is internal. It's the state of uneasiness, the fear about the future that we feel. Stress is how the body reacts to a stressor, real or imagined, and can come from any situation or thought that makes you feel a strong emotion. Some level of stress is actually good for us. It's only when these become overwhelming and interfere with our ability to function optimally that it becomes a problem. This visual depicts the relationship between performance and stress level. The vertical axis represents performance, increasing as you move up. The horizontal axis represents stress level, increasing as you move to the right. The curve starts at the bottom left, rises to a peak in the middle, and then falls back down towards the bottom right, forming a bell shape. From left to right, we start with the green zone, which represents too little stress, and includes the labels inactive at the start of the curve, and laid back, a little higher on the curve. The yellow zone represents optimum stress, and is where the peak of the curve is, indicating the highest performance level. Just before the peak is labeled fatigue. Continuing to the right, the orange zone represents too much stress. Just past the peak is labeled exhaustion. The final zone is the red zone, which represents burnout. As the curve slopes down sharply, it's labeled anxiety, panic, anger. The bottom right is labeled breakdown. Thus, a moderate level of stress can lead to optimum performance, while too little or too much can negatively impact performance. This provides motivation to do things, without being overwhelming. Where would you fall on this bell curve? Things will increase our stress, but there are also things we can do to decrease our stress. We can take care of ourselves. Get enough sleep and eat well. Exercise. Self-soothe. And relax purposefully. These can help us keep our stress on the left side of the bell curve, where we want it. It's important to distinguish between earned and unearned worry. If you didn't prepare adequately for the test, it's understandable that you could be worried about it. This is earned worry. It's a normal response to you not being fully prepared. A lack of adequate test preparation is the #1 cause of test anxiety. Overwhelmingly, feeling confident in the material is the best thing you can do to prevent or resolve test anxiety. But maybe you are prepared, and your mind goes blank during the test. Or you're panicking. You're having difficulty performing well despite knowing the information. This is unearned test anxiety. Test anxiety is not a mental health diagnosis, but it is a condition that can cause you distress, and it is treatable. Test anxiety has two separate pieces, the cognitive and the physical. The cognitive is the way your mind and emotions work when you're afraid. Some cognitive signs of test anxiety include your mind going blank, difficulty concentrating, and difficulty with comprehension. The physical is your body's sympathetic nervous system being activated. This is also called the fight or flight response. Physical symptoms of the fight or flight response can include rapid heartbeat, perspiration, racing thoughts, and muscle tension. You may feel like you're hyperventilating. Your vision and hearing may become acute. This primitive part of our brain does not prioritize higher-level thinking, instead focusing on bodily functions necessary for survival. Thus, being in this state won't serve you well during a test. We need to address both sides of this anxiety to resolve it. This is not something that is magically cured. It involves learning new skills to reduce the physical response, so our thinking brain can take control. It also involves changing how we think about ourselves and the situations that we face. Our anxiety comes from us, our attitudes, expectations, and perspectives. Assessing and changing these takes effort, but it will pay off in more ways than just reducing your test anxiety. Practice these skills, and cement these cognitive changes, so that when you're in those anxious moments, you'll be ready. Some examples of how to manage anxiety include deep breathing, using coping statements, visualizing being in a comforting place, and speaking to yourself with kindness and grace, instead of negativity and judgment. We go into more depth on some specific strategies to improve test anxiety in other videos on our channel. Thank you. Please contact our office at 706-867-4402 with any questions or if you'd like support.